Good morning. Welcome to this event. This event is organized by our class here at United Theological Seminary, Global Encounters at Our Doorsteps. So the basic presupposition in this class is that globalization in all its forms are happening not only in other parts of the world, but even here in our midst. And we have many topics, including the predatory global market, immigration, ecology, foreign policy, and this time today we are dealing on health and healthcare issues. And we have our speaker, John Marty. Senator John Marty has been a state senator since 1987. He is a strong advocate for government ethics, environmental protection, and affordable health care for everyone. Senator Marty co-chaired the Legislative Commission to End Poverty and previously chaired the Minnesota Senate Health Committee. He is the author of the proposed Minnesota Health Plan, a single statewide plan that would cover every Minnesotan for all their medical needs, while saving money through prevention, efficiency, and elimination of bureaucracy. Senator Marty is a graduate of St. Olaf with a BA in ethics. He and his wife, Connie, have 2 adult children and live in Rossville, Minnesota. It's my honor and privilege to welcome Senator John Marty. Thank you.
Thank you, and I'm very glad to be here, and I'll apologize because I just heard it was supposed to be at 10:30. I was given 10:45 to 11:45, and so I will start right away. And on the topic, I'm actually going to take this off because it's warm in here. On the topic of healthcare as a moral right and healthcare for everyone, it's interesting because we've just gone through a huge national debate, probably the hottest issue for the last 2 years, 3 years, and we're roughly where we were 2 or 3 years ago. We're the only industrialized country in the world that doesn't provide health care to everyone, which is costly in many ways. It's the number one cause of bankruptcy. More personal bankruptcies occur because of health care than every other cause combined. And most of those are not the uninsured. Most of those are people with insurance, but $5,000 deductible or $10,000 deductible, and so many things even for those who may not have that high a deductible policy that aren't covered. And all of a sudden, so 3/4 of those people who declare bankruptcy because of health care were insured. And so it's something that all of a sudden it picks somebody out of what we think of as the broad middle class of American society and knocks them into bankruptcy. Even more troubling is the fact that it has health consequences. 45,000 people in this country die every year from a lack of health care. That's a huge number. I can say it's 120 some a day. That begins to ring home a little more. The way I'd put it into how we ought to think about it is if you go to Washington, D.C., one of the most powerful monuments you can visit is the Vietnam Wall. And when it was first built, a lot of the veterans groups were saying this was an insult to veterans because the conflict of Vietnam was so harshly contested in this country, and the black slash it was supposed to look like, and so on. Now I think most of the veterans group would say it's one of the most powerful monuments they've ever seen. Why? Because the long row and the names engraved in it, very simple design, and you look at those and you read each of those names and you think what that meant, how precious that individual's life was, usually 18 to 25-year-old males. Think what each of their lives meant to their family and everything else. Well, there are 57,000, 58,000 names on that wall over a decade of a war. We'd fill a new wall every year and a quarter with the number of Americans who die, equally valuable human beings who die because they couldn't afford to see a doctor because of our healthcare system. So it's a tragedy and an outrageous one. And it's interesting how often you can get good, powerful quotes on things from going back a number of years. Martin Luther King said, of all the inequalities in American society, the greatest injustice of all is the lack of equality in health care. And the people can't get it. And I like to suggest to people it's not that it's an impossible thing to do. Our society's always been able to tackle challenges. I mean, we think of ourselves as a can-do society, the American dream. We were a little arrogant at times, but a sense that we could do anything. And in the 1960s, we seem to have begun to lose that, and since about the 70s, we've never had this confidence that we can fix any problem. In 1961 and 62, when Kennedy said, we're going to put a man on the moon before the end of the decade, that was rocket science. Never been more than 25 miles from the surface of the planet, and we're going to send people 250,000 miles away and get them back safely. And we did that. We could do that. That is rocket science. Providing health care to everyone isn't rocket science. 30-some countries do it, not just the first world nations. I mean, you can get down to Slovenia and Taiwan and Turkey and Poland, not what we'd call first world nations, but they provide health care to everyone, and they keep their people healthier as a result and save money. But in our country, we have a lot of problems in doing that. And so when one party, I'd say, has this philosophy that less government and no vision, but less government, it's an ideology, a philosophy, less government, and sort of a social Darwinism, it's everyone for themselves. My party happens to say, oh, that's terrible, that's going to hurt people, that's going to everything else. So what are we going to do? Well, more of the same. We want to cover everyone. There's a lot of good rhetoric in my party about how we're going to cover everyone. We ought to take care of people's needs. But when it comes time to actually put something into law, well, we could never really do that. That's not politically feasible. It's not going to happen, and so on. So we get a presidential election and a new president who says the number one priority is going to be provide health care for everyone. And he told some powerful stories. His mom died, I think, at her early 50s from cancer, and how she shouldn't have had to be worrying in her last weeks of life, not thinking about her future and her son's future and so on, but worrying about how they're going to pay the bills and whether it's going to bankrupt the family and so on to do that. And he talked about the moral implications of failing to do that, and the implication that being that we're going to change that. And the statement was we're going to provide health care to everyone. It's a right, and I think it is. But the way our political system is colored and so on, they develop a health care plan that I think even if he got everything he wanted, and he didn't get everything he wanted, but even if he got everything we wanted, we wouldn't be covering everyone. And the final bill was worse than that. And, well, I hate to put it down because it does lots of good things, too. It'll provide health care for 32 million Americans who don't have any. That's huge. And we might cut the death toll from lack of health care from 45,000 to half that. That's huge. But on the other hand, at the end of a decade, if this thing works the way it's supposed to work, we're still going to have 23 million Americans with zero health care, and another 100 to 150 million who have health care, have health insurance, but like those people who go bankrupt from lack of health care now, they don't get the coverage they need. They don't go to the dentist because that's not covered. This isn't covered, that's not covered, and we got $15,000 deductible, so we don't do a lot of the preventive stuff. And so at the end of a decade, we're going to have roughly half the country who don't go to the doctor when they need to because they can't afford it or don't have access to it. And that's not doing that good. I mean, as I said, it's not rocket science. When Slovenia and Poland and those countries can do it, we could do it ourselves. And the thing that bothers me most about it is, I know there are people who oppose doing this. When I said the Republican philosophy seems to be it's everyone for themselves, and it's not government's problem. If you ask them, how is it going to help someone who can't afford health care, I think they'd say, and They'd say, well, I think insurance companies, if they're not regulated so much by government and so on, they'll do a better job, and charities and nonprofits and everyone, somehow or another, that may help fill the gap. It'll be more affordable because insurance companies aren't regulated and everything else. And you tell them, oh, come on, let's be real. That's not going to provide health care for people. It's not going to do it. And their response would be basically, well, not my problem and not the government's problem, because that's the philosophy. But for those who do say they want it, and I say we should take people at their word, I mean, I think that's one of the frustrations in politics is people say something and they don't really mean it. But when a lot of people in my party say, we want health care for everyone, it's a right, we mean that. Well, maybe we ought to mean it then and provide it. And I think the trouble is, and I'm not going to get into all the arguments of why it happens this way, but real briefly, I'd say that part of the reason for that is, well, it's certainly the fact that there's a lot of money in the political system and a lot of interests who are saying, hey, we don't want to do this. And a lot of human nature, people who receive the big money and they're lobbied heavily and so on, aren't bad people, nor are the people giving the money, but it's a conflict of interest system, and they don't do what they ought to do because of that. And that's one of the reasons. The other one is a lot of people in my party think it's not politically realistic and it's going to hurt them politically if they do something that really a lot of people might want. And I'd say sort of instead of a politics of principle, the principle being, if you take them at their word, that we want to provide health care to everyone. And the alternative, the politics of pragmatism, I'd say misguided pragmatism because it doesn't work, but politics of pragmatism, you do that. And let me give you a very direct example related to this issue and the Federal Affordable Care Act or Obamacare, whatever people want to call it. When President Obama was speaking to a joint session of Congress in August of 2009, he had been in office 9 or 10 months. This was the centerpiece issue, the big fight, and so on. And he asked for a speech to national address, in effect, in front of a joint session of Congress. I think it was August. And he goes there, and he starts out, he says some glowing things about basically the principle. We want to cover everyone. We want to do all this good stuff. And he's understanding. He's speaking to 535 politicians, some of whom are very worried about their futures and getting reelected and their own interests and everything else, and they're filtering it through that. So he steps back from we're going to cover everyone, and he's on the defensive because there's some things that are just really unpopular, so we shouldn't do it. So you step back from the principle and go to the pragmatism, and you take the group that's probably the most controversial for covering when you talk about health care, undocumented immigrants. And because Congress is never going to stand for that, you step back and say, don't worry, he said, this is almost a direct quote, don't worry, we're not going to cover people who are in the country illegally. Loud applause. Well, no, there wasn't. There's a guy who stood up and said, you lie. Remember that? He's on the defensive, and they go after him. So the response is, go more on the defensive. So the next morning, his administration says, well, okay, we understand we told you, but we want to make it absolutely clear. We're not only not going to allow them to buy into the public option, which they were pushing for at that time, but we're not going to let undocumented people get health care through private insurance exchange that we're setting up for the states for everybody else to be able to buy their insurance. And so you're on the defensive, so you back up further, and what happened to the politics of principle, the idea that we're going to cover everyone, make sure every human being has what we call a right to health care? Because he has called it a right, a moral issue and a right. And what if he took a different approach and decided, well, we're going to stick with forget the politics for just a second, but let's say he's going to stay with I believe health care is a right and everybody ought to be covered. I don't care how they got here, why they got here, when they got here, but they're here and let's take care of people. Supposing he said that and said, now we've got this very political 535 members of Congress sitting in front of him, and he says, Okay, now I understand the politics here, and you folks are going to be as concerned, and this is a hot-button issue, but we're going to cover people. We're going to cover everyone, including people who are in the country without documentation. We're going to cover everyone. I know you're going to say that's politically suicidal. Well, I'll tell you what's politically suicidal, and he goes on and tells perhaps a couple of stories. I think what's really politically suicidal is the idea that we're going to take people who are working in our meatpacking plants, preparing our food, serving us fast food at McDonald's, and we're not going to treat them even if they've got infectious diseases because of where they were born. You get the sense, your reaction, some of these members of Congress start to think, ooh, that's kind of gross. That's not really good safety. That's not really good for us. And they start, maybe some of them think he's right. And he can also he can tell another part of the story. And the reality is we're covering them already. We just wait till it's the most expensive care possible in the emergency room and the hospital. And what's really politically suicidal is to wait and spend the most money possible on people that a lot of people don't think should be covered. Why don't we cover them up front and save money? If he said, don't worry, if he said instead of don't worry, we're not going to cover, he said, I told you, healthcare is a moral right we're going to provide to everyone. And then tells that. What's the guy going to do, the opposition going to do? Stand up and say, you're telling the truth. That's a really brutal attack. And I'm not saying that all of a sudden that this guy who said he was lying is going to all of a sudden support what he's trying to do. He's going to attack him no matter what. I'm sure he'd still attack him, but you can't attack him for lying then. Because he's being blunt. And he's appealing to that kind of thing in people. Would it change American politics? Would it change the outcome? Who knows? And I understand there's some people who really don't care. I happen to think it is immoral, the idea that some kid, take a 12-year-old kid in an auto accident, bleeding on the side of the road. Bleed to death, kid. I just don't think we're going to do that as a people. I don't think Americans would do that. There's some who would. But I don't think as a society we're going to really do that. And I don't think most people think that's right. But this does take appealing to the common interest. And before I turn real quickly into how I think we ought to deal with this, and then open it up, I want to talk about the blank for a second. I'll get back to it in a minute. The moral issue of providing health care to everyone by appealing to the good in people is something that I think we have to recognize human nature. I'm not a psychologist, not a theologian, not a psychologist. I don't understand it all, but I do think all of us, whether they're Tea Party people or Occupy people or wherever they are in the political spectrum, most human beings by their nature have some generous instincts, concern for others. After a tragedy of any kind, a hurricane or 9/11 or an auto accident, people stop what they're doing. Somebody they don't know, they want to help them, they care about others, they really do. We have that common interest in us, the generosity and the goodwill towards others. We all have some of those instincts. And likewise, we all have some fairly, perhaps we might call them baser instincts. Fear, hatred, selfishness, greed. I think we all have those in us too. And the political system has traditionally had some appeals to one, some appeals to the other. I use the example of in the 1960s, maybe use Hubert Humphrey appealing to the one, saying, by golly, we're good people here in Minnesota. We care about our seniors. We're going to fund our nursing homes. We're going to take care of them. That's an appeal to the good in somebody. Not because you need it, but because somebody you might care about, other people need it, and we ought to do it. And that appeal really worked. Didn't sway everybody all the time, but some of the times it worked, some of the times it lost. The alternative appeal, which also worked some of the times and also not all the time, I would say was kind of took control after about 1980 when Ronald Reagan came in saying, who can spend your tax money better, you or the government? Meaning the government who's going to give it to those lazy people who somehow or another are going to cheat you out of a system. And I understand that does appeal to people. So both those appeals work, but since about 1980, there's never ask anybody to sacrifice, never ask anybody to do something for somebody else. And never talk about how we're in this together as a society. That's why the example I gave with undocumented people, talk about who's preparing our fast food. I mean, you go to the meatpacking plants in Minnesota or in any state, and it's largely immigrants, a lot of undocumented people. It's very dangerous, hard work. And when you have the raids of meatpacking plants, it's not an uncommon thing because of immigration things. Same thing, you look at fast food joints in a lot of states, a lot of people are undocumented. The people who are handling our food. So I'm serious about that. But we never try and talk about how these things, how somebody else's well-being might be in our own. And I'll give one more example of that and then talk about how we address healthcare. And that is July last year, the Star Tribune had a big front page story about a family trying to get mental health care for their child. The mom was in-depth profile of the mom and talking with reporters and what they had gone through. A 3-year-old kid used a knife and slashed all the furniture in the house. And they knew from early on this kid had some severe mental health challenges. And all the way through the kid's childhood, they were trying to get him health care. And she tells the reporter how she finally succeeded a couple years ago. And 16, 17-year-old kid, he got into an inpatient mental health program for really, really troubled kids. And then she told the reporter how after the kid her son had been in this program for 12 days, they kicked him out for spraying a fire extinguisher on one of the staff people. And the mom's saying, I know that's not a good thing to do. I mean, your kid does that at a school, you're going to have a lot of problems. But she's saying, that's for a kid who's severely mentally ill, that's not unexpected. And some of the counselors in the program actually told her, that's the kind of opportunity we have to make a connection with the kid somehow with an incident like that. In the end, she found out a couple of days later that they had just, the day before they kicked him out, found out that their insurance program only covered 10 days inpatient. He had been there 12, and they kicked him out. And anybody reading the story, I don't care how hard-hearted you are, you're going to feel sympathy. You're going to say, I'm glad my kid isn't in that boat. Oh, I feel sorry for this woman and so on. But basically, in our society, we treat it as, but beyond that, we hurt for them. We wish they were better off than that. But it's not our problem. My health care, my family's health care, kids, everyone is kind of my responsibility. Your family is yours. And I care about you, but it's your issue, it's your problem. It's that way. Well, not really. The reason it was a big 2/3 of the front page of the Star Tribune last July is this is a kid who went out and killed 2 convenience store clerks in Iowa. And that does affect all of us. And maybe we ought to start thinking about how we're in this together. When somebody else is hurting, it affects all of us. And maybe it's in our interest to be taking care of each other as a society. On a broader scale between nations and peoples, we ought to be caring for each other instead of trying to decide we're afraid of them, so we're going to fight them. I mean, we don't have the second voice in American politics at the national level about how we might have other ways of dealing with other countries. It's always not that the talk softly and carry a big stick isn't an important part of a defense policy, but where's the idea that we could maybe work with people and try and find out what we can do that would help them? I mean, after World War II, the Marshall Plan, where we invested our former enemies, a year earlier, 2 years earlier, our enemies shooting us, and we're investing in rebuilding their countries? Well, this common good thing we don't talk about enough, and we ought to, because that's part of the conversation that's missing. Now, quickly, the solution, because I wanted to open it up in a couple minutes for discussion. Well, providing health care to everyone isn't rocket science, as I said. And the way we try and fix health care in our country is, well, maybe we can do a little more of this or a little more of this, or we can tinker with this or change that. And that's why I'd say the federal reform is bold. As I said, covers 32 million people, but tinkering, because it fundamentally changes nothing. You're still going to be fighting for, can you be covered by this, by your employer? If not by your employer, can you do it this way? Can you get it this way? Can you get it through your parents? Can you whatever? So there's a whole range of ways that people try and plug the gaps, but the bottom line is it's not something we're all going to do. What if we started, instead of saying, how can we insure more people, or how can we get more people to mental health care, or how can we get this or that, what if we started where we want to get to? Instead of saying, I favor this kind of health care reform or that kind of health care reform, well, that's my philosophy, that's what I'm for. Instead, start with the goal. What we tried to do in education many, many years ago, say, everybody going to get an education or Social Security. Every senior is going to get Social Security and retirement benefits. Everybody. What if we decide we're going to do that with health care? We're going to provide health care to everyone because it's in all of our interests. We're going to be a healthier society, better for us, actually save money if people are healthier, better economy. What if we start with the idea everybody's going to have health care? And then we work back from there. Now, how is the best way to do that? And that's the approach I think we ought to do. In politics, we often, here's what I'm for. Now how is that going to fit in with what our goal is? Instead of saying, here, what's the goal, and then work back from it. And I think that's what Taiwan and some other countries did. They said, we want to cover everyone. How are you going to do it? Some, it just kind of evolved over the years. Some made a conscious decision at a certain date, we're going to cover everyone. And if you're going to cover everyone, you might decide we want to do it by making the most efficient way possible. How do you provide health care to little kids? Maybe the ones who are kindergarten and older, who are in school all day, you might want to have somebody in the school available to provide health care, like a school nurse. We used to have them in every school, but we kind of dropped that because it's expensive and it's not directly related to education. It has an impact. But what if we provided a nurse in every school? Well, under our current system, who's going to do it? The schools don't have the money because it takes away from education. But you could also provide it through a health care plan. Well, Blue Cross, they do all these community advertising and Just Do It campaign a couple of years ago, whatever. Very nice things, public health promotion. They're doing those because they had to with some of the money they got out of the tobacco settlement. Couldn't be just focused on their own members, but on the broader public. But who's going to fund a nurse in the public school? Health Partners, Blue Cross, United Health? None of them are. They've only got a small fraction of the kids in the school. They're not going to do it. But if you decide you want to put in public health nurses in schools, maybe some downtown big firms, and you want to make sure everybody's covered for it, you might say, why don't we do it? I use the analogy often of police and fire. Public need, everybody needs it. How do we orchestrate it? Well, when you need some help, you call. Your home is being burglarized, you call 911, police dispatcher, oh, burglary in progress right now. Okay, where are you? They come out right away and help you. The one thing they don't ask is, do you have police insurance? Does your policy include home burglary coverage? Who's paying the deductible? They don't ask those things. They cover you. And what if we were to do the same thing? Well, you need to go to the dentist. Your tooth is aching. Okay, well, there's some dentists. There's one over there. My dentist is not that far from here. There's dentists over there, and so on. And you go to the dentist, or you go to the doctor, you go to the nurse. You go to the pharmacy and pick up what the doctor prescribed. And we just do that. It's a lot cheaper. Instead, we spend all our time making sure nobody gets any health care that they might not absolutely need. Because, of course, we're all going out there and thinking, I'd kind of like one of them titanium hips. Mine seem to be fine, but they sound kind of high-tech, and I'm kind of that kind of guy. People don't like to go to the doctor more than they, but what if we just design it? So I designed and worked with a number of others on Minnesota Health Plan, which is a single plan. We call it a single-payer plan. But it's single administrator, single payer, single network. Everybody's in it. And you deliver it to everyone. And you cover everything. And Vermont had a study done of a plan in their state. They concluded it would save about 25% over what they're doing now, and cover everyone. And I think that makes a lot of sense. It helps in not just by taking out a lot of administrative costs, which is making sure. I mean, you just last week or 2 weeks ago, Senator Franken had hearings about this. Fairview Systems had this firm from Chicago that was coming and doing their billing. And I went to the hearings, and they actually had a woman who had a kidney stone. And Franken said, doctors sometimes ask you on a scale of 1 to 10, what's the pain level? People usually have 8 or 9, or she's a 12. But I mean, those who had kidney stones, I've been fortunate not to, say it's excruciatingly painful. And she's drugged up and everything else and in pain, and they're asking her about paying the bill. And this other guy who had a lung transplant was in a follow-up visit and so on, and they pulled him away from his wife, didn't let his wife go in with him, pulled him in a room and grilled him on how they're going to get money from him. He wasn't even behind on the bills. But you take all that bill collecting stuff out of it. You take all the insuring stuff out, all the time employers have to do it. You save money in that. Plus, by keeping people healthier, you take care of your dental care preventively. You don't have a tooth abscess, you don't have an infection, you don't have hospitalization. And you save money all those ways. And you keep people healthier. You address mental health and chemical dependency. Just assuming we did this for a while and said we're going to say if you need mental health or chemical dependency treatment, you're going to get it. I know we still blame people for being chemically dependent and so on, but the more we know, the more we realize it's a health issue. And if we provided treatment to people who needed it when they needed it, if you can get them in, whether it's the law enforcement or their employer or their family or themselves saying, I need alcohol or drug treatment, and then you don't have to, well, how can I pay for this, and can I get a couple of sessions of this? But if you need inpatient, you get inpatient. If you need outpatient, you get outpatient. You get what you need. You know what that would do to the crime rate? You know what that would do to domestic violence? 9 out of 10 domestic murders are committed under the influence of drugs or alcohol. 40 or so women and children murdered in domestic abuse situations every year in Minnesota. Think what that would do to our prison population if you don't have so many people committing crimes. You save money in all those ways. So we designed a health care plan. Everybody pay into it through a premium. Might look like more like taxes to people because it'd be based on ability to pay. Provide coverage for everything. And I think that's the moral issue is, are we going to do that or not? And I frankly think that both parties are scared to do that for a variety of reasons I didn't really get into. But I think that's the moral issue, and I think it's one we could do. And when 30 other countries have figured it out, we could do it too. Anyway, with that, it's been a little over half an hour, so I'll open it up for discussion, questions, either on what I've been talking about or anything that branches off or things I didn't say. So who wants to start? Yeah.